Welcome, 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 and thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to better inform you, because the more information you have, the better decisions you can make. And knowledge is power. And today's topic is about smoking and bone health. And bringing us this great information is Dr. Sharon Allen on Tobacco Use Research Center from the University of Minnesota. Welcome, Dr. Allen.
Thank you, Tina. Thanks for having me.
I'm so delighted that you could come on Knowledge for Wellness and to educate my viewers on this, because now that the actual tobacco research has hit a lot of the youth, we need to make them more aware of how much they're hurting themselves.
That's right. That's very true.
Yes. But I'm not sure that other viewers had seen our previous show, so I'd really like for you to take a moment and to let my viewers know a little bit about you and your love and your passion and why you went into this profession.
Well, I love being healthy. Okay. And my research is about smoking cessation, particularly focusing on women and helping them to quit, whether they're young or whether they're older. And I also have a passion about taking care of yourself in terms of your skeleton, your bones, and there are things that people can do very easily to promote their bone health. And one of them is to quit smoking, for sure. So,
yeah, I know I had to quit smoking, and it was a very, very difficult thing for me to do. But I was pregnant at the time, so I had a lot more incentive to do it because of my unborn child.
Right. Yeah. That's an opportune moment, and that's a great thing to try and quit when you're pregnant, but a lot of women in the postpartum period relapse. And in fact, we're going to do a future study on that to try and help women to stay quit once they've delivered the baby. Okay, well, that'd be great. That would be a great new show for that as well. So, okay, well, I want to back up a little bit because I want to talk about bone health and, of course, in women, because we're hearing so much as women get older that their bones, we have some issues. So it would be great if you could explain to my viewers exactly what bone health for women. Good. Well, osteoporosis, by definition, is bone loss.
Okay.
And this actually occurs as women get older. And if we look at the first slide, you can actually see a comparison of what looks like healthy bone versus an osteoporotic bone.
Okay.
There is actually loss of the bone. And the bone itself, the strength of the bone, is two qualities. There's a density and there's also a quality of the bone. And we do have a very good way of measuring the density of the bone, which is called a DEXA. A lot of your viewers may have already had a DEXA. And that gives us the density. But there's also another part of the bone which is called the quality, which we really don't have a good measure of. And it's the combination of both the quality and the density that gives us the strength of the bone. And when the bone becomes osteoporotic and there's loss of bone, then the bone becomes more fragile and the person is more at risk for fracture.
Sure.
And this all occurs as women get older.
Yeah, we hear a lot about women breaking a hip.
Right.
And they're more susceptible to it than a male.
Right. Yes, the risk for women age 50 and older is about 50% that they will have a fracture of a major bone in their lifetime. And that's really very high. That's fairly significant. And then there's complications that come related to that. As you'll see in this next slide, there's a certain amount of mortality that occurs, but even more important, a lot of morbidity that actually results from a hip fracture in particular. People can't walk without a device. They can't do their daily living functions. And so there's a significant impact of fracture on a person's life. And so our goal is to try and prevent fracture.
Yes. So what can women do to improve their bone health then?
Well, there are really some very simple things that women can do, which is exciting because people always want to, to be able to do something. First of all, they can make sure they're getting adequate calcium intake, and you can get that from your diet, any kind of dairy products. A 8-ounce glass of milk is about 300 milligrams of calcium. 8-ounce serving of yogurt is about the same. And if some people just don't like dairy or can't tolerate it, they're lactose intolerant, there are supplements on the market which are very good. For example, Tums, calcium carbonate, and there's calcium citrate. There are multiple kinds of supplements on the market. And we encourage people to take at least 1,000 to 1,200 milligrams a day, depending on their age. The other important thing about taking some of these supplements is that they really have to kind of spread it out throughout the day. They can't take it all at once because the body just doesn't absorb it. And the other thing is that patients complain a lot about the bloating sometimes and the constipation that they get with calcium products. And so I encourage my patients to start slow with the supplement and to increase it slowly, and then they pretty much can tolerate it.
So let's say that they can take a calcium pill if they don't actually enjoy any of the dairy products. So one in the evening so that they're sleeping and it won't upset their digestive system, and then they can progress, and maybe like after breakfast and lunch. And again, depending on the type of calcium they take, sometimes they have to take it with a meal, such as the Tums, to get it to work or to get it to be absorbed effectively. And other calcium, such as calcium citrate, you can take independently of a meal. So it depends on what the patient really wants to do. So you were talking about smoking and bone health. So if we could back up a little bit, and explain to my viewers about the relationship between smoking and bone health as well.
We do know that smokers have lower bone density. And we do know that when they quit smoking, their bone density can improve. And we're not exactly sure what the mechanism is, whether it's the byproducts of combustion of smoking or whether it's the nicotine in the cigarette itself that is actually affecting the bone cells. In the normal balance, or in the normal skeleton, say in the reproductive years of a woman's life, there's a good balance between how the bone deposits and then resorbs. There's constant remodeling going on of the bone. But then when a woman hits perimenopause and then menopause, the whole process gets out of balance, and the resorption of the bone outdoes the deposition of the bone. So that's why the bone becomes so much more fragile, because there's bone loss, there's more resorption. And in a smoker, there is even more resorption. And so the bone becomes more osteoporotic, and the risk for fracture goes up.
And I also, when I was quitting, my doctor explained to me that your lungs actually improve as well. Because if they had a picture of someone when they were smoking, and then 3 months later after they quit smoking, your lungs even improved as well.
That is true. Your breathing for sure almost right away improves, and your exercise tolerance. And by the time you're 10 years as an ex-smoker, your risk for lung cancer does go down to that of a normal person's risk. So your lungs do improve.
It sounds like your whole body improves.
Yes, absolutely. You have more energy, you feel better. I can really tell when I see patients almost 90% of the time if they're a smoker. Their skin has a kind of a sallow looking color, and I can really pick out smokers fairly easily.